Hi, I'm Dr. Kris Okumu. I am an orthopedic spine surgeon. I'm originally from Uganda, East Africa. I was born in Uganda, lived in Uganda and Kenya, where I went to school until I was 9.5 years old. And then my family immigrated to Sacramento, California. We were escaping a dictator named Idi Amin, if some of you remember who that is. Bad guy. Well, anyway, we ended up in Sacramento, and I grew up in Sacramento. I had a life very much like many immigrants. You start off kind of on the bottom and work hard, study hard, and get to where you need to be and take advantage of opportunities that are there for you. I graduated from high school in Sacramento, went off to college at Berkeley, and it was then I decided I was going to become a physician. I actually wanted to be an astronaut or a fighter pilot, but I wasn't an American citizen. We could talk about that another time and what that led to. But I ended up studying biochemistry and at Berkeley, and eventually was accepted to medical school at UC Davis, close to home, and went back to Davis. Was president of my class in medical school. Did a lot of really fun stuff in medical school. I was the co-director of a clinic that served a community that was underrepresented, or underserved actually, in healthcare. It was predominantly African American community when the clinic was started by the medical students, but with the shifting demographics, it became a clinic that served a very African American and Latino community. The bottom line was individuals who didn't have health insurance, and we were able to take care of them without them having to be concerned about that. UC Davis was one of the first places, or first medical schools to start some of these free clinics for people in the community. In any case, I then decided, a long roundabout way, to become an orthopedic surgeon, and it was just by chance. I was pulled into an operating room by a surgeon, and I looked around and I saw all these tools. I'd been working on my mom's lawn, putting in a sprinkler system. I'd been putting hardwood floors in her house because it was last year of medical school. This is about the time you can kind of relax a little bit because you're waiting to see where you're going to go residency. So I walked in this operating room. I saw all this stuff, drills, saws, things like that. I said, what is this, and why didn't anybody tell me about this? So I changed my application, canceled my application. I was going to become a urologist, and I applied to orthopedic surgery and was accepted into a program in San Francisco. And finished my orthopedic surgery residency in the Bay Area, had a great time, and then went off to New York to do my fellowship in spine surgery, inspired by that same surgeon who first interested me in orthopedic surgery, who is a world famous spine surgeon. In fact, he told me when I decided to go to become a spine surgeon, to go to New York and train with one of his best friends at a place called the Hospital for Special Surgery. So I was there for a little over a year, learned a lot, still in contact with a lot of my professors from there because they taught me quite a bit, and I still call them up from time to time and ask them for advice about patients and surgeries, because that's what good doctors do. Anyway, that is sort of in a nutshell my life in, was that 3 minutes? 4 minutes. There's a lot of other details, but that's about that's the short story.